Welcome to our channel dedicated to health and disease. Here you will find up-to-date and reliable information on a variety of health-related topics, from chronic diseases to wellness tips. Our goal is to help you better understand your body and take care of it in the best possible way, providing the knowledge you need to make informed decisions about your health. We know that navigating the world of health can be challenging, which is why we're here to provide clear and accessible information, as well as bringing in health experts to share their expertise. Join us on our journey in search of a healthier life. Don't forget to subscribe to our channel and leave your comment on today's video. We appreciate your presence. You know that depression is a mental disorder that affects almost 10% of the world's population and is characterized by constant feelings of deep sadness, apathy, loss of interest in previously pleasurable activities for a considerable period of time, at least 2 weeks. It is a serious disease that needs treatment, as it considerably affects the social and professional life of the individual, impairing their relationships and ability to develop simple tasks. In addition, depression can help trigger or potentiate other physical health problems, further aggravating the overall picture. Sleep problems are directly linked to depression, either by their excess or lack thereof, and this activity is essential for maintaining the daily activities of the body. What are the symptoms of depression? Symptoms of depression can be quite varied and may present as follows. Apathy, loss of interest in activities that once gave pleasure, concentration and memory problems, feeling of lack of energy, low self-esteem, feeling of guilt, loss of libido, irritability and anxiety, thoughts of death or suicide, sleep disorders, insomnia or excessive sleepiness, changes to more or less in appetite in general. Depression is characterized when 2 or more of these symptoms persist for more than 2 weeks, sparking an alert for immediate search for help, in this case, a psychiatrist. Difference between depression and sadness. Many people use the term depression or being depressed to emotionally anxious states of sadness. However, this expression is inappropriate in view of the seriousness of the depressive disorder and everything it represents. Unlike depression, sadness is a natural feeling and through which we feel the losses or sufferings and resin certain memories in order to overcome some specific episode. That is, in the case of sadness there is a cause, as an important loss for us, as someone we love or even the job. About this, there is a process of mourning that is natural, in which good memories are mixed with sorrows in waves of feelings that come and go and that pass after some time. Moreover, sadness seems to be the most enduring feeling, because when something makes us happy, we quickly return to the natural state, but when we are sad, it takes us longer to overcome. Precisely for this very part, we must understand that sadness is a passing feeling, that is, its duration should be days and not weeks, otherwise a warning sign is lit, where apathy, hopelessness, indifference and disgust can arise and remain so that a depression arises. What can cause depression? Although depression and sadness are different with we have previously highlighted, depression can also be caused by an unovercome sadness. Hence the importance of looking at yourself carefully and seeking help when something seems to get out of control. Genetic predisposition, changes in brain chemical processes and socio-environmental factors can contribute to the development of the disease. Even insomnia can generate depression. In some cases, genetic factors increase the risk by 70% for the development of depression. If you have a parent who have had depression, for example, your chance to develop the disorder doubles. In general, any situation of prolonged or high-intensity emotional stress, called stressful events such as job dissatisfaction, breakup of a long marriage, death of someone very important in your life, physical or psychological trauma, weight problems, and even the very unbridled use of social networks can be crucial for a depression to set up. The lifestyle can also be an additional to the risk. Diets rich in sugar and sedentary lifestyle are part of this group, as well as the consumption of toxic substances to the body, such as alcohol, drugs and even some medicines. It is important to remember that there is not only one determining factor for depression, quite the contrary. Depression is caused by the sum of these factors, and one can contribute to the other in a way that minimizes the ability of our brain to react to certain events, causing prolonged symptoms and, consequently, depression to arise. How How is the diagnosis made? The psychiatrist is the doctor responsible for diagnosing depression. In a consultation, he will talk openly with the patient about his life and events. Based on the reports brought, the psychiatrist may suggest performing some tests to know if the origin of depression may be hormonal, for example. Similarly, it will indicate the best treatment for your case. The psychiatrist considers the degree of depression to choose the best treatment, since the disease can manifest itself mildly, moderately, or severely. How is the treatment of depression? The treatment of depression will depend on the intensity of depression that the person is facing, but in general, the treatment has two great allies: antidepressants and psychotherapy. The best treatment for each person will be determined by the doctor, in addition to the intensity, with the time factor, i.e., in how much time of therapy or medication the patient will achieve a significant improvement in his/her condition. The use of antidepressants, contrary to what many people think, is not with the aim of keeping the patient dependent on the remedies, quite the contrary. These medications are aiding in a faster recovery, so that after a certain period of time, the patient can, by itself, lead his life without needing them. In this process, psychotherapy, especially cognitive behavioral therapy, CBT, can help the patient, through practical thinking methods and attitude in his/her day-to-day life, to gradually overcome the depressive condition. Like the medicine, psychotherapy is not eternal, and the goal is to overcome the depressive condition. In some cases, only CBT can be indicated. In others, there is a union of antidepressant use together with psychotherapy, in order to accelerate the process and promote better quality of life to the patient. The change in lifestyle may also be prerogative in the treatment of depression, considering that this is a causative factor of the disorder. Therefore, to treat depression in the best way, it is necessary to follow the medical recommendations, because both the psychiatrist and the therapist are the professionals qualified for the treatment of depression. Pharmacogenetic testing can also be indicated, as it uses the patient's genetic material to determine the best drug to treat the disorder, increasing treatment assertiveness by up to 50% in some cases. Attitudes that help fight depression. The main factor to combat depression is self-care. That is, to look at yourself with loving eyes and attention, perceiving your needs and not neglecting your physical and mental health, because both are intrinsically linked. How? Taking care of food. Do physical activities. Socialize in a healthy way. Take your sleep seriously. Watch yourself, practice self-care, and don't be afraid to ask for help. That's it, AI. We hope that this video has been enlightening and has helped you learn more about the subject covered. If you liked the content, please leave your like and share with your friends and family. If you haven't subscribed to our channel yet, take the opportunity to do so now and turn on notifications so you don't miss any of our upcoming videos. Thank you for coming to us, and see you next time.